Hello, everyone, and thank you for joining us for this month's Strengthening Families National Network webinar. Today we are focusing on strengthening families through child welfare practice, and we're excited to see that so many people registered for today. It must be a hot topic. So we'll go ahead and jump right in. I'm Kaylin O'Connor from the Center for the Study of Social Policy, and I'm going to open us up with these introductions, share a little bit about this series of webinars, and then we'll get into it. So this is a webinar we do each month on the second Thursday of the month. It's an open invitation to folks who are using the Strengthening Families Protective Factors Framework or coordinating Strengthening Families efforts that might be at the local or state or system level. We convene these jointly between the Center for the Study of Social Policy and our partners at the National Alliance of Children's Trust and Prevention Funds. And each month we have a different topic with guest speakers, usually guest speakers, and we coordinate that either by CSSP or the Alliance, or sometimes by a volunteer from the Strengthening Families National Network. All of the recordings and materials from past webinars are posted at this Google site that you see on your screen right now. That link will always be in our newsletters that go out and in the follow-up email you get after the webinar. And the materials from today, including the recording, the slides, and the handouts, will be on that site by early next week. Another thing worth noting is that we do have the recording happening in GoToWebinar as well, so you can always click through the follow-up email you get to that recording link, but that will only have the recording, not the other materials. So if you can wait a couple days, you can get everything at the Google site. So coming up, the second Thursdays of the month, I've got listed here. I actually don't have the topics quite locked in yet for those months, so keep an eye on the newsletter that goes out, the Strengthening Families e-update. Look on CSSP's events page and look on that Google site from the Alliance to find out what the topics are and get registered as those get closer. And I know we've got some volunteers who have been in touch about those topics, for those dates, and I just need to get back to folks. So if you're waiting on an email from me, it wouldn't hurt to email again, but I will get back to you soon. And my email address is there, so that if you ever like to suggest a topic or a speaker that you think would be really great on this webinar, or volunteer to share about your work, I'm happy to do that, so always let me know. All right, so our agenda for today, I'm going to share some updates from the Center for the Study of Social Policy, just a couple. And then Meryl Levine is with us from the National Alliance of Children's Trust and Prevention Funds. She'll be sharing some updates from the Alliance, which also include a lot of really relevant material to our topic today about strengthening families through child welfare practice. And then I'll get into that topic, sharing some slides and materials that we've developed at CSSP that you are free to use. So, oh, there's my picture. I maybe should have had that sooner. That's who's been talking this whole time, Kaylin O'Connor at CSSP. I wanted to share some community action briefs that we just released. They're all on our website. I didn't actually put a link here, but if you go on our website and search for any of these titles or look in our Young Children and Their Families section, you will find these publications. They're each about 4 or 5 pages long, so very brief and action-oriented with examples from communities. One is about equity in early childhood systems. One is about using data to advance outcomes for young children and families. And the other is about parent and family engagement. And those all come out of our National Collaborative for Infants and Toddlers work, which is not explicitly connected to strengthening families, but definitely runs across a lot of the same themes and is all about other ways to support parents in building protective factors in community level work. I also wanted to point out that the Build QRS conference is coming up at the end of June. I think you can register, if not right now, then very soon. Actually, yeah, you can definitely register now. The website is there at the bottom of the screen. I just wanted to point out some of the sessions that I will be involved in and my colleagues from CSSP will be involved in. We'll have a session about prioritizing race equity and parent leadership, learning about the manifesto for race equity and parent leadership, which we released a few months ago. And some parent leaders are coordinating that session, but I'll be there to jump in with a few pieces of information. We are doing a consultation session about early childhood system performance assessment on the Wednesday morning of the conference. Our partners from Mosaic and some of the local folks who are using that system will be doing a session about cross-sector data to support continuous quality improvement and promote equity in family engagement, school readiness, and beyond. That's also Wednesday morning, right after our consultation session. And then on Thursday morning, I'll be leading a session about quality improvement and family engagement and how states are using the Strengthening Families Protective Factors framework in their QRIS. And that last one in particular, I wanted to point out, I've reached out to a few states to find out if folks will be at the conference and want to share an example during this session. If you got back to me on that, thank you, and I will be reaching out soon to plan that. But if you will be there and want to talk about how you're using Strengthening Families in your QRS, I would love to have you join us. So please contact me if you want to be part of that. We're still shaping it up to see what examples will be shared. All right, I'm going to hand off to my colleague Meryl Levine to share some updates from the Alliance.
So thanks, Kaylin, and good afternoon, everyone. It's great to be here with all of you today. I am the Senior Associate with the National Alliance of Children's Trust and Prevention Funds, and I'm excited to be able to talk with you a lot about the work that is relating to helping child welfare workers and parent partners learn more about protective factors. So today I just wanted to kind of start out and just announce, before I even go into this, just to let everybody know, if you don't know already, that the Alliance this year is celebrating its 30th anniversary as a national membership organization that supports state children's trust and prevention funds. And so together, as probably many of you already know, we've created a strong national network that works to strengthen families, promote child well-being, build healthy communities and effective systems to prevent child abuse and neglect. So starting off and taking a look at this slide, I don't know, I'm pretty sure a lot of you already know about our work, but just wanted to make sure that I wanted to share with you that based on, in order to address the critical need for formal and accessible national training for staff and parents interested in the Protective Factors framework, the Alliance actually created a free of charge 14-hour online training entitled Bringing the Protective Factors to Life in Your Work. And it includes 2-hour courses. Each course, the first one begins with the introductory course, and then it's followed by 5 sessions which really actually specifically focus in on the 5 protective factors. And then we close it up in terms of talking about how to move all of that knowledge into action. And based on the positive feedback that we got from the online training, we then moved and created a 3-day in-person training, and that has really taken off extremely well. And many of the individuals that attend those trainings become certified training in their state once they go through this 3-day intensive process. Many of the trainers, the certified trainers, are actually child welfare trainers who train child welfare staff in working with parents in terms of helping them develop protective factors. So I just wanted to share briefly that I don't know how many of you know, but for example, in the state of New Jersey, through their Department of Children and Families Division, they actually train all of their workers around the protective factors, and they have really developed a full array of resources that they have brought to their workers in terms of helping them talk about the protective factors with parents. Some of the other tools that I'll be talking about as we move forward, we've got quite a nice array of tools that our Alliance National Parent Partnership Council has developed related to the protective factors as well. And they actually are a lot of one-to-one types of tools, as well as some group tools that I'm going to be talking with you about. And the Alliance also has developed what we call the Birth Parent National Network, which is a large network now, continuing to grow with over close to 300 birth parents and organizations that are working together in terms of champion parents and elevating the parent voice and getting parents involved around policy and practice issues that affect children and families. So, of course, protective factors is always part of that discussion as we move those efforts forward. Kaylin, can you move to the next slide now? So here I just wanted to bring everybody up to date. As you can see, many of this really is reflecting our in-person trainings, and today we have over 1,100 Alliance certified trainers all across the country who are basically training staff and parents in their states using the Protective Factors framework. And as you really can see here, we're in the majority of states now. So that's pretty exciting, and we are continuing to grow. So if you're interested in getting involved in that particular training, please feel free. Martha Reeder is our primary contact for that, but I will be happy to pass your name along. And then next slide, if you could bring it up. So I just wanted to say one of our newest tools is the Social and Emotional Competence Conversation Guide. This is a really exciting new resource that the Alliance National Parent Partnership Council developed, and it's really for helping parents support their children's social and emotional skills. And really what it is a, if you could go to the next slide, it is part of our need to know resources, but the actual guide itself is really more designed to be used as a group type of tool, but certainly can be used as a one-to-one kind of resource as well. But the guide is really designed to help facilitate an informal group conversation about ways to support children's social and emotional development. It's co-led by a parent facilitator and also an organizational partner. And the discussions really focus around 5 different question areas. And each of them relate to 5 everyday actions for this particular protective factor. But in terms of if you wanted to use it more as a one-to-one, you could really take the questions themselves, and if you were having a conversation with a parent, make it, talk with them about addressing specific questions in that kind of way as well. The actual group discussion itself takes about an hour to implement, and it's really a fruitful type of opportunity in which we can really, as the Alliance, gather information around what is happening in terms of parents and workers working together in terms of helping to support the development of the social and emotional development of children. There are an array of tools also that the Alliance has developed in order to guide you in using this particular conversation guide. So if you do have any kinds of questions, we hope you'll take advantage of them. All of them are available on the Alliance website. And in addition to that particular tool, I just want to remind people that the Alliance Parent Partnership Council, our ANPPC, which is our parent council that works in partnership with all of the work that the Alliance does, has also developed some individualized, more concrete examples related to the everyday actions to build protective factors around parental resilience, social connectedness, knowledge of parenting, and child development. So again, there are a host of resources that are up on our website, and we hope that you'll take advantage. We have just recently changed our website, so we do hope you'll take a look at it, and we're hoping that you'll find it to be a little bit easier to navigate. So with that, Kaylin, can you go to the next slide? So here I just wanted to kind of remind people that the Alliance also has been very committed to helping parents understand the factors related to preventing child neglect. And as most of you probably know, child neglect is one of the most prevalent forms of child maltreatment with serious long-term consequences. And really, when we look at our statistical data over the course of time, between 60 to 80% of the cases that come even into the child welfare system are primarily relating more to neglect than to abuse. But neglect in itself is it's probably the least clearly defined, understood, and publicly recognized. So it becomes more and more important that we begin to raise the conversation around this kind of issue. And so the Alliance really has become more and more involved in terms of trying to elevate issues related to prevention of child neglect. And so you can see on this slide as well, we've done a lot of creation of tools as well. We have some presentation tools, infographics, a range of infographics, and we have now, I'm just going to talk with you briefly about a new training that we have developed, which is really our newest tool. And Kaylin, you're doing great in terms of moving me along with the slides. And this new training tool itself incorporates 4 training sequences. And basically each one of the sequences, as you can see up here on the slide, lay the foundation around defining neglect, looking at the assumptions that we might be making and encouraging us to look more deeply into this issue itself, looking at ways to prevent it and how the protective factors can really act as a shield, and looking at what people at all levels of the socio-ecological model can really do. Each one of these sequences really includes a presentation that explores the topic, and it really incorporates parent voices throughout. So it helps to really make it live and real for people understanding the issues that parents have faced in terms of dealing with neglect types of issues within their own life experiences. There is also a discussion toolkit that has been developed that includes the learning objectives, a reflection journal with questions that you could consider, and also an adult coloring sheet. And there's lots more types of activities as well. So we hope you'll take advantage of that. And the link is right there on the website for that one as well. I'm moving us along now to the next slide, which is one of our areas of customized training and technical assistance. Again, where we work in partnership, as you're hearing, in partnership in everything we do with parents, as far as guiding us in our directions, as far as what we want to move forward with as the Alliance, and moving in terms of ways to prevent child abuse and neglect. So what we really were hoping in this particular slide to just kind of alert you to is that we want to help ensure that child welfare systems can benefit from the expertise of parents who have been through the system or who were at risk of being in the system. So some states have created parent advisory councils, and so the Alliance has also gotten more involved in that arena as well. We have been working with a number of different states right now that are linked with the child welfare systems, but a lot of them are tied also to their prevention units. So these prevention councils are key in terms of us seeing them as parents who are being trained on the protective factors, and they in turn are really, many of them may also be mentors within the systems that will be involved in talking with other parents in their local community around the protective factors training as well. Just wanted to alert you as well that we do a strategic sharing type of training, where that is really a more specialized training we do to help parents learn how to share their lived experiences in a meaningful and a focused kind of way so that they can get their messages across in a limited time frame, but actually have their audience really understand exactly what action they'd like them to take. And then the last piece, we always have been, for quite some time now, been utilizing community cafes, and we certainly are able to help organizations if they're interested in setting up community cafes and training around that area as well. And if you could take me to the next slide, Kaylin, which is the one tied now to the Birth Parent National Network. And as parents really build strong protective factors, they often want to link with other parents and help to make improvements even in their own communities. So the Birth Parent National Network, which is a virtual network of parents and organizations, works really together to really champion the voices of parents in helping to really strengthen families, communities, and systems. So the Alliance developed and manages this particular network, and it's continued to grow as well, as I mentioned earlier on. But parents and the organizations really get involved in this kind of network to have an impact in terms of policies and practices that affect children and families. For example, we just recently had one parent who is Lucretia Rose, who is not only the co-chair of our Alliance Parent Partnership Council, but also a member of the Birth Parent National Network. She just was involved in sharing testimony in front of a congressional hearing of the Education and Labor Subcommittee, and talked about issues that would help really inform policymakers around issues that are involved right now regarding the reauthorization of the Child Abuse and Prevention Treatment Act legislation. So her testimony is up on our Alliance website, so we hope you'll take a look at that. But this is one of the really great ways that we have really seen parents grow and really begin to help in terms of educating others around protective factors as well. And then I just thought I'd mention one other one. We had another parent just recently through National Child Abuse Prevention Month. She was on a panel in San Francisco, and it was a blue ribbon luncheon that was sponsored by an organization called Safe and Sound in San Francisco. Soledad O'Brien, the award-winning journalist and speaker and author, was actually the panelist moderator. And so Jody did a great job. One of the parents did a really great job sharing her experiences with the audience. So those are some ways that parents are involved with the network. And then this last slide before I close out, I just wanted to make people aware that through the Birth Parent National Network, we have really developed a wide range of resources, and a number of them have included issue briefs. And we also look at a way, and these briefs really involve critical topics that really come from a parent perspective when they're developed. So, for example, the BPNN puts together an issue brief which was entitled "What Parents Say About Using the Protective Factors to Understand Substance Abuse and Recovery." It is a really great resource. So I just wanted to let everybody know that I know Kaylin put those handouts up on the screen here, and you can download them. There is a handout right there for the these issue briefs. I put one sample of an issue brief up there. There's also a Birth Parent National Network, or BPNN, flyer that you can download. And then also there is a new resource, which is our customized training and technical assistance brochure that we just developed. So feel free to use them. If you know of parents that might be interested in getting involved with some of our activities that we're doing, or if you know of people that are interested in doing some of the protective factors training, please feel free to reach out. And my contact information is on the last slide. And I just want to say thank you for giving me the opportunity to provide this update. And I'll turn it back to you, Kaylin.
All right, thank you, Meryl. Those were great updates and so relevant to what we're talking about today. So wonderful fit to share those resources today. All right, we are going to jump into our topic today, which is building protective factors through child welfare practice. And just to be clear on what we're doing here, this is a session that I was going to present at the National Conference on Child Abuse and Neglect last month. And obviously doing something on a webinar is very different from doing it in an hour and a half in-person session. But I had planned to also share these materials and content on a webinar so that those of you who couldn't be at the conference or who missed that session at the conference could learn about it and have these materials to use. And I ended up not being able to attend the conference for family health related reasons. So I was then even happier that I had scheduled this webinar so that I could still get this good content out to all of you. So what we're going to do today, I'm going to share slides and supporting materials that CSSP developed that are designed for training child welfare caseworkers. The slides are built around what should be a very interactive process. There are a number of small group activities. So I'm going to walk through sort of where those fit in, but we're not going to do them because we have a shorter time and because that's hard to do on a webinar. And then we'll talk about how you can use and adapt these materials for your jurisdiction. And one of the things that we're not covering today, which I would love to do on a future webinar before too long, is to really learn more about the various ways that people already are implementing strengthening families in their child welfare systems. We have some that have dipped a toe in that. We have some that have jumped in, in the deep end, are really using protective factors throughout their systems. And so I want to check back in on that in the next couple of months. So keep an eye on when those get scheduled to continue this focus on implementation in child welfare. And if you have something you'd like to share for that, you can type it in as a question or comment during the webinar today, or you can contact me afterwards and we can make a plan, because I know there's such good work going on out there. But today I'm just going to share these materials that are available and hope that that can help other people get more involved in doing this work. So what's included in the training that I'm sharing today is talking about the 4 big ideas behind strengthening families, the 5 protective factors themselves, and then small but significant changes in practice to help families build protective factors. Then we share tools to help you shift your practice and focus on how you can take care of your own protective factors speaking to a child welfare caseworker audience. I'm going to go through some of these pretty quickly today, but just know that there is content in these slides that you can use to expand on any of these ideas more than we will today. So I always like to start with this quote from Dr. Carl Bell, who said so succinctly that risk factors are not predictive factors because of protective factors. And the reason that we have rolled out this Strengthening Families initiative and why we're particularly interested in having people use it in child welfare is because we know that focusing on risk is limiting for how successful we can be with families and at a community level. So we want to think about family strength. We want to focus on things that we can change and that we can celebrate with families, and protective factors achieve all of those things for us. So the 4 big ideas behind Strengthening Families, and I will say we have a set of slides about each of these big ideas, but for today I'm just showing the high level, what each of them are. The first is that focus on protective factors. We know that when we focus on risk, we may miss some of the families that we would want to be concerned about. We may pull in families that are actually thriving because of their protective factors, although they would appear on paper to be at high risk. We also risk alienating families if we're reaching out to them in a way that focuses on risk rather than on their strengths. And when we talk sincerely and authentically with parents about the strengths that they have and the strengths that they want to build for themselves and their kids, we can be in a much more productive conversation that's not adversarial and that really helps families understand and define what they want to do for their own well-being and their children's well-being. So that's the first big idea, is the big one, focusing on protective factors. The next idea behind Strengthening Families is that it's an approach and not a model. So there is no set curriculum of what you do if you're implementing Strengthening Families. It's not a certain number of sessions. It's not a certain way of implementing a program. It is an approach to whatever way you work with families, and something that it's a lens you can apply to think about your work with families and to make what we call small but significant changes. And part of what's critical to that is that acknowledgement that you're already doing a lot of good work, and the Strengthening Families approach can help you make some changes to that without having to throw out what you're doing and do something else instead. It's more, okay, how could I be more inviting to parents in this way? How could I expand how I think about what families need based on these protective factors and add some services or make better referrals or whatever that might be? But it's not getting rid of whatever model you're using or whatever your general, strategies are, if you're, depending on what kind of setting you're in. So in the child welfare context, what that means is this isn't a practice model that replaces your current practice model. But it is something that you can apply to all of the different ways that you interact with families and improve on that and get to better outcomes for the children and families that you're serving. The third big idea is a changed relationship with parents. So really fundamentally rethinking what our relationship is to parents, particularly in systems like child welfare, which have, as I said, traditionally been adversarial. And where we have opportunities to say, we're actually on the same team, wanting these kids to do the best they can, and figuring out together what we need to do to get there. And different families will need different levels of support and intervention, and all of our families need different levels of support and intervention throughout our lives. So approaching it from that team-based thinking, and where parents are members of the team and ideally leaders of the team in figuring out what's going to be best for their kids and their families. The fourth big idea is alignment with developmental science, where there is on a daily basis more research coming out all the time that helps us better understand brain development, what's going on with early adversity and toxic stress, what's going on with brain development in those first 3 years of life and also in adolescence. And with Strengthening Families, there are some tools that help point practitioners and caseworkers toward more developmentally appropriate and developmentally informed practice without having to become experts on the brain science. They can make changes in their practice that better align to what children need given their current stage of development. So we actually have a protective and promotive factors frame that goes across the lifespan. Strengthening families' protective factors is what we're focused on in these webinars and today, where when children are young, we focus on the environment they're growing up in, and their parents' protective factors are critical to the children's well-being. As children get older, their parents' protective factors are still very important, but we also need to start looking at the children's own competencies, which we have this parallel framework called Youth Thrive, Protective and Promotive Factors for Youth. That's very parallel to the Strengthening Families factors, and which in child welfare systems where most staff are serving children of all ages, you really need to think about both of these frameworks in terms of how can we take a protective and promotive factors approach with every family that walks in the door, whether that's primarily through how we're working with the parents or primarily through how we're working with the youth or adolescent. Excuse me. The other thing I was going to mention is that this is particularly relevant when we're working with young parents of young children who the parents themselves are still in a critical developmental phase and will have their own developmental needs. And when we work with those parents, if we can acknowledge the parents' developmental needs as well as the child, we're going to get to better understanding of what's going to work best for that family unit, and applying both of these frameworks at the same time can be very helpful. So the family protective factors that we focus on are listed here. I also have a slide here that has our definition of each of them, and depending on the audience you were doing this presentation for, you might want to pull up our other slides that go into several slides about each of these protective factors. For today, I'm going to assume that most of you are on this call because you already know a few things about strengthening families, and so I'm not going to spend some of our precious time on defining the protective factors and talking about why they're so important, but rather just remind us that this is how we define each of these, and we're going to focus today on the practice changes that help us focus on protective factors rather than focusing in detail on the protective factors themselves. So when we're in a child welfare setting, we have goals of our work, which are, the way we are articulating them here, are that we want to meet the developmental needs of children and youth. We want to have developmental supports in place that are informed by understanding trauma and what impact that has on children and youth. And we want to support the capacity of families and caregivers to keep children safe and support their healthy development. Those are all the goals that we're focused on that get us, it's a little bit different from talking about safety, permanency, and well-being. But when we're thinking more conceptually about what we want to do with children in the child welfare system, families in the child welfare system, these are some of our concerns. So we identify windows of opportunity in our everyday casework practice that can help us focus on those issues. And so whether we're, any stage along the phases of child welfare or the types of work that we do with child welfare as families come into the system and move through it, we have opportunities to work on child and youth development, on being trauma responsive, and on protective factors. So today we're going to talk mostly about how we have that focus on protective factors, but you'll see that the other two about, attention to trauma and attention to child and youth development more generally are woven throughout this as well. So this is the big circle, the practice wheel as we call it, where you'll see around the edges, these smaller circles, are different ways that we interact with families when they enter and go through the child welfare system. Most child welfare systems have their own practice model, which this is modeled after the general areas that those tend to include. Of course, it may be different for your specific jurisdiction, but these are all aspects of how we work with families that should be represented somewhere in your case practice model. And you can always modify how this wheel looks to better correspond to a specific practice model, if that's what people use where you're speaking to them. So what we're going to do is talk about small but significant shifts in practice that you can make at each of these points around the wheel that will help shift towards a protective and promotive factors approach and paying attention to those and promoting them for families. Let me actually take a step back. If you look in your handouts on the side of the webinar, as Meryl mentioned, she had some handouts in there from the National Alliance. We also have handouts that are the slides for today. So when I say you can modify this, you can literally download the PowerPoint and make modifications to it. But there's also one there called CW Handout Packet, Child Welfare Handout Packet. And what you'll see is that that has worksheets about each of these sections of the practice wheel. And it also has at the back of it some case studies. So I will explain how we work through that in one of these trainings. But that is the basic model, is that you have you talk about each of these sections of the practice wheel, and then you stop at several points and have small groups work on a family and a case study at how they would approach these different tasks with that family. So the first step is engaging families. And we really talk about engaging families being something that's a continuous process. It's not just the first time you meet them, although we all know first impressions are important and set the tone for a relationship. But in every interaction with families, we want to be engaging. We want to be open and caring. We want to make sure that people get the feeling that we are someone they can trust. We're someone who will listen to them and respect them, and that we're someone they can turn to for help. All of those things can be conveyed in how you greet and interact with families, what you are encouraging families to do, how you're structuring that relationship, whether you're kind of coming in with a top-down, you know, who has power kind of approach, or whether you're greeting them, as I said, as a partner on the team to ensure their children's well-being. And what you'll see in the handout packet is a list of things that you can do in those everyday interactions that would reflect an engaging and welcoming relationship. So you will see there's a sort of, it's called a practice reflection tool that you can check, do a rating of your own self of how frequently, how consistently you engage in this kind of practice. And we actually have a set of practice reflection tools for each of these steps in the that we're going to go through in the life of a child welfare case, but those are available on our website for all of them. The one for engaging is the only one that's included in your handout packet, and that's the one that we use as a tool in training to help people start to do that reflection, and then point them to the others for their own reflection later on. So that's engaging, and typically I will talk about engaging and assessing, and then we'll get into the case study of a family. So when we talk about assessing families, this is about both formal and informal assessments. So there are the formal assessments that we all need to do depending on what our system requires. And we are always thrilled when systems are able to modify those assessment forms to include family strengths, whether they're stated as protective factors or not, but to include family strengths, and ideally to start with family strengths. So we're asking families about their strengths before we dive into what brought them to the attention of the system and what the challenges are that they're facing. If you are not using forms that integrate that, you can still start the conversation that way. You can do your own, you know, informal conversation before you launch into the formal assessment tool. And of course, we're also informally assessing families all the time as we, you know, just are monitoring how they're doing and asking their questions, asking our questions of them. Those are all forms of informal assessment. And in all of those cases, if we can start from places of strength, ask what's going well before we dive into what's not, that builds that relationship and helps families to see their own strengths and focus more on building them. Another point that's on here is about sharing information with families. That's specific to some of the assessments that we might do of children when they're in the child welfare system. Oftentimes those developmental screenings, other assessments are done on children, and the results may not be shared with the parents. They may be shared with a foster parent, they may be shared with a pediatrician, a preschool teacher, but it's really important to share this with the parent as well. Whether the child is living with the parent or is in out-of-home care, parents want to know what's going on with their children. And if we go to the trouble of completing this assessment and then don't share the results with families, that communicates a pretty strong message to the families that they're not considered a partner in promoting their children's healthy development, or it's a missed opportunity to communicate that they really are a partner there. So encouraging all of that thinking around assessment. So in the training, what we typically do is after this section, we get people into small groups and have them work with one of the case studies. This is the back of that packet. There are 4 case studies there. 2 of them are for families that are not involved in the child welfare system, and 2 are families that are involved. So depending on your audience, you may want to focus on one or the other, or pick the one that's in kinship care, or pick have the room divided between one that's child welfare system involved with getting in-home services and the one that's in kinship care, or choose some of the preventive ones for a different audience. And people tend to respond really well to those case studies and have fun kind of finding the family's strengths. So the assessment one is about what strengths do you see in this family, and a worksheet that helps you look at each protective factor and say where you see that in the description of this family. As we move through the rest of the parts of the practice wheel, the small groups will have to embellish what's written in that case study, kind of decide what's happening next. So some creative thinking can go into that. Most people seem to appreciate that. I'm sure some wish it was all just written there, but it makes it different every time. And the small group can decide, sort of how they're going to take this and how they're going to keep moving the family through their process of being child welfare system involved, and where that is going to go for each of these segments. All right, so the next step then is integrating protective factors into case planning. So really looking at not doing case planning as a checklist of these are the things we're supposed to make sure families do, but really looking at what are the challenges, what are things we can build in that would build protective factors and respond to the challenges at the same time. So, for example, here we see the challenge in that big splash graphic. The mother's not providing adequate care to the child when she's overwhelmed. And so that's something you would arrive at through conversation with understanding what's going on in this household, that this mother is feeling overwhelmed. And so you could set an objective that this mom needs to work on her self-care and, recognizing when she's starting to feel overwhelmed and taking some steps to get past that before it affects her child. So some of the activities you might build into the case plan would be that the mom's going to call her sister when she's starting to feel overwhelmed. She's going to do some self-care activities, which depending on that mother, it might mean she's going to take a walk every day, pushing the child in the stroller. It might mean she's going to be able to actually have time to herself and go do some meditation or, do other forms of exercise without the child there. Whatever self-care might be for that mother, and that would be built into the plan. And develop a calming routine for when things feel overwhelming. So when she can recognize for herself that she's starting to boil over and stop that process by using whatever calming techniques work for her. So that's an example of what that could look like for really having, looking at what's very particular to this family's needs, what's causing the problem, and how we can address it in a strengths-based way. I should say, at this point we do another activity with the small group and start planning out a case plan for the family. And as I said, the case study does not have enough information in it to know exactly what the situation is, but most people who have been working with families for a while will have some ability to to fill in those blanks and say, here's what might be going on with this family. So let's say the mom said this, and then we'll make the case plan based on that. So again, with the creative thinking and applying what they know from the families they've worked with in the past. Then we get into decision making, and this is something that can vary a lot from jurisdiction to jurisdiction in terms of whether there's family team decision making or another model being used, or whether there isn't a lot of including of parents or any formal process for including parents in decision making. In any case, there are ways to apply how including parents in decision making can be done in a way that builds the protective factors. And I'd say if you're working in a jurisdiction that doesn't have a formal process, maybe this can help you make the argument that that should be happening. So this slide details how including parents in decision-making builds each of the protective factors. I'm not going to go through all of them, but I will point out at the bottom we have the social emotional competence of children and the idea of engaging the child in teaming whenever possible. Obviously that is very age dependent and maturity dependent, but for children who are getting old enough to have and express opinions about their own plan or what, whatever is the appropriate level of input for them to have, making that a formal part of the process whenever you can is something that we recommend to build both those youth protective and promotive factors. And in the case of children where their parents are also at that decision-making table, that's a powerful process for them all to be involved in the decision-making. Then we get into intervening, which of course varies a lot depending on what's going on with the family, what the system reaction is to their case. But we have a handout about building protective factors through casework visits. So assuming that you're making visits to the family, and what kinds of questions would you ask to get at protective factors and to support the parent in recognizing and building on their own strengths, and how you would interact in a way that builds that up. Resilience is one of the things that certainly gets built when families see that they are being asked about these things and they are not just at the mercy of the system, but they are actually being listened to and respected. That in itself builds resilience, but all of the protective factors can be built through those interactions as you check in on, what are you doing about, do you have friends you can call when you're struggling, and things like that that can help people also see what, can help us understand that the family is building the connections they're going to need to thrive once they leave the system, so that we can feel comfortable about what services and supports and informal connections are in place. And if we're asking and promoting them to build those, then we're going to be better off as the case progresses. The next stop on the practice wheel is monitoring and adjusting the case plan. And so here we're really looking at how you reflect protective and promotive factors in case notes and documentation, what you are observing when you do observations, how you're noting those down and what you're emphasizing, and trying to shift that to focus on whether the family is making progress on the goals that hopefully they have set themselves and that hopefully are related to strengths and protective factors, whether the family is struggling in some areas, and whether adjustments are needed in the plan based on their progress or based on the challenges they're facing, but just having that regular check-in. And there's a worksheet in the packet that looks at monitoring progress towards case closure. So that actually spans this stop on the practice wheel and the next one, which is case closure and transition. We have some jurisdictions that use that worksheet or a version of it actually at the beginning of a case welfare, a child welfare case to engage with the family. And here are some of the ways that we'll be looking at whether you're improving. So let's fill this out together of what we're looking at for goals. And then some who may not do that at the beginning, but use it to check in as they're monitoring and adjusting the case plan, and then as they get towards case closure, to check on whether the family's made progress. And then these three last questions on the slide are really about how are we confident in the long-term well-being and thriving of the family as we think about transitioning them out of having an active case open. Okay, so that's the sort of process we go through. And as you'll see in the packet and in the notes for the slides, there are different points where you get into those small groups and look at what's going on with the family in the case studies. There are a number of other tools. They're all available at this website at the bottom of this page. That's all about strengthening families in child welfare practice. And I'm actually going to show you that page right now. Whoops, that's the wrong one. I was going to show you that one too, but let me go to, this is the Strengthening Families part of our website. So you go to cssp.org and click through to Strengthening Families, or just go straight to, well, we have strengtheningfamilies.net, which is currently not functioning for some reason, but we are trying to get that to redirect to this page. So go to our cssp.org and click through to Strengthening Families, and then these tabs will take you where you need to go. So under the Systems tab, you can click on Implementation and Child Welfare Systems, and that's where most of these tools live. So there you'll see all of these individual handouts that are in the packet that you have today, the Taking Care of Yourself, which we'll touch in on in a moment, a coaching guide for supervisors to sort of work with one of their caseworkers in supervision to talk about how well they're focusing on protective and promotive factors and where they need more support. The practice reflection tools, which a person can use individually or again can be used in supervision, and an action planning tool for the worker and supervisor to complete together about how their worker is going to prioritize gaining skills and knowledge in this area. And where I was before is where there's a lot more training materials. So I'm going to go back to the slide here and just point out that we also have parent surveys that you can use. I know that there are probably too many forms that need to be filled out already in every single child welfare system around the country. But if you do have room for another form, you can survey parents about their protective factors as a way of moving towards understanding where they're growing and where they still need support. So the other thing I wanted to show on our website, I'm jumping around now, I'll go to this, is that we have a bunch of slides on the website that are this 8-module curriculum that we put out probably 3 or 4 years ago. I don't know how many of you have used them, but I really encourage you to check them out. A lot of what we've looked at today is the heart of Module 5, but we have a whole module about an introduction to the framework, which includes those 4 big ideas. We have a whole module about the protective factors themselves, which includes looking with activities related to each protective factor, so you can help people really internalize that information. There's a module about Youth Thrive. There's a module about trauma and brain development. Module 5 is the one we've mostly focused on today, with that going through the practice wheel and the activities related to each of those types of interactions with families. Then there's Module 6 about taking a community approach. Module 7 is the research behind strengthening families, in case you ever want that. And Module 8 is about tools to support implementation. So all of those are there, free to download. Each of them is slides, a sort of trainer script in the notes for each PowerPoint slide. You do not need to read that verbatim, but we know that people like to have, read it through in advance, maybe make your own crib notes of what you want to make sure to cover, but it's all there, and then the handouts. And then, of course, you can download those individual practice tools. One thing that I skipped, and which the last time I had to skip this, someone gave me a really hard time about it, like, oh, of course we're skipping self-care. Wouldn't that just be the way it goes? So we want to make sure to spend some time on taking care of yourself and other staff. And I think one of the beautiful things about the protective factors and the reasons that it resonates so much with people who encounter it from whatever field they're in is that the protective factors are not just about the families we serve, they're about all families and our own families and our own selves. So we can use the protective factors framework to think about our own well-being, not just the families that we work with. So we have these handouts about self-care. We encourage that systems and supervisors are making sure that they check in on their workers and how they're doing, particularly after a really tough case, or just a long stretch of a bunch of tough cases, whatever that might be, to make sure that we're encouraging people to take care of themselves. And you can see on the, I'm on the wrong website, wrong page again. Here we go. We've got taking care of yourself. That is a handout for caseworkers. On the website, you will also find there's one for foster parents. There's one for kinship care providers. We also, in other parts of our website, have one for home visitors and one for early care and education providers. So seek those out to make sure that we're all paying attention to self-care of all of ourselves and the folks that we work with. A couple more minutes here about how you can adapt these tools to your jurisdiction. As I mentioned, you can download these slides. There are probably more slides than you want to use in some of those modules, so you can delete the ones you don't need. But for example, for child welfare systems that use the protective capacities approach, there's often a lot of confusion about how that relates to protective factors. So we do have slides in Module 5 that explain that relationship, which you want to use if you're in a system that uses that, or maybe want to delete if they don't use that and you don't want to introduce another concept that might just be confusing. You can adapt those decision-making slides to reflect the model or approach that you use. So if you're using family team decision-making, and you can get really specific about, meeting structure and how that should be different, you can do that. You can use more or less of the big ideas and the protective factors content, depending on whether you're talking to folks who are already familiar, and just how much time you have as well. And then let me know if you need to adapt any of the handouts or worksheets. Everything is posted as a PDF, but I'm happy to share Word versions of it if you just need to make some changes in the text. We are always happy to provide that support. So thank you all. We've got just a few minutes left. Sorry I was talking fast at the end there. I wanted to wrap it up and make sure we have a few minutes for questions. If you have a question, you can type it in. You can also raise your hand in the webinar, and I can unmute you if you're in a place where you can speak. And you can also just type in a question and I can read it off. So if you have a question, go ahead and type it in, or if you have some thoughts, feel free to share them and I can read them out loud and just share them with others, which would be, how might you use the tools in your state or community? Sort of what ideas sparked for you as you saw these materials? What adaptations would you need to make? What audiences would you like to reach with this? I'd love to hear that, whether right now in the webinar or if you want to send me an email later. So far, I don't see questions coming in. We did have one comment, someone who just signed up for our mailing list while I was showing our website. They saw that option, so thank you. We do have a question, and I'm having one of those days where the question box isn't big enough. There we go. So Tammy McCallum wrote, sorry if you already covered this, are these tools free to use or adapt as you would like in Site CSSP? Yes, they are. You can definitely use them and adapt them. Let me know if there's major adaptations that you're making, if that would tell me something about what we need to do for these tools for others to use. If you're finding it's just not a good fit. But if there's minor adaptations you need to use to build it into something you're already training on, go ahead and do that. Another question came in about a training certificate. GoToWebinar does give auto-generate a training certificate, so you should get that in the follow-up email that'll come out about an hour after the webinar ends. I'm not seeing any other questions right now, and we are just about at the end of our time. So I'm going to go to this slide that tells you more about how to stay connected with the SSP. Everyone, be like Victor, who said he signed up for the webinar, sorry, for the mailing list. We have mailing lists specific to strengthening families, and also one about our equity work, one about our early childhood system building work. So sign up for as many of those newsletters as you would like to receive. And then you'll always know when one of these webinars is coming up and when we release cool new resources, which we do all the time. So I think we will go ahead and wrap up. Thank you all for participating. Thank you, Meryl, for sharing the resources you shared at the beginning of the call. Thanks to everyone who listened to me talking really fast at the end here. And we will talk to you again in about a month. So thanks, everybody. Bye-bye. Thanks, Meryl. Bye.